I was asked to keep it short, so I put my presentation on this little sticky note. I spoke actually last Wednesday. I spoke at ASU. I don't know if y'all seen ASU. They got this podium that's like this big. I really liked it because it made me look slim. This one does not make me look too slim. But thank you for having me and my team. Some of my team here. I really am honored. I love this beautiful sanctuary you guys have. And this is actually the first time I've ever spoken in a church. I have spoken over into y'all's recreational area. But thank you for your time. And I'm just going to touch one on COVID-19. And before I do that, I want to recognize, I was really blessed before I became, when I came to work for Shannon in 98. Within 2 months, they had actually hired Brian Horner. He was my mentor for 18 years. And luckily, he never, I know he probably wanted to fire me a couple of times, but he never did fire me. But I was blessed to have him as a mentor. And not only him, I'm very fond, really, of Beth, more so than him. But in what we do in leadership, it's a team sport. And my wife's a very important part of my team. But Brian and Beth mean a great deal to me. And I heard a message one time. And the gentleman, the minister was talking about there's 5 people that throughout your lifetime that have a great impact on you and personally. And when I think about those 5 people, that list gets really small really quick after you take, in my case, I think of my parents. My wife doesn't leave very much, but I would put Brian in that top 5. So thank you, sir. COVID-19, it's kind of like... man, I wish it'd go away. But what we're seeing since July 1st, so this is just as of July 1st, we're seeing about 8 out of 10 patients that have tested, as well as 8 out of 10 patients that are hospitalized, not vaccinated. So that's what we're seeing here in the Concho Valley. Now, around the country, you're seeing that more around 90%. We are seeing, these are the positive cases by week. So you can see just over the last couple weeks, the number of positive cases is really spiking up. 2 weeks ago, 535, and this last week ending Friday, 637. Most of it's coming in the younger generation, less than 40. The positivity rate's kind of climbing up, which is concerning. As of today, we're right at a census of COVID-19 of about 67. And what's a little different about this, and ICU's right at 12, so they're really spiking. It's really spiking quick on us. It's really changed a lot from Monday. To me, it was real manageable up until Monday evening, and so I felt like we're ahead of it. Now I feel like we're a little bit behind it. A lot of that, what's happening with us, is back when we saw COVID census really high. Back around October through January of this last year, we had a lot of people down here helping us with dealing with this spike from the state, nursing, doctors. So far, we haven't seen that, so we're trying to deal with it just with local, here locally, which has been a little tough. Now, as I left today, I heard the state is going to be sending some help, so I'm really glad to hear that. It'll probably take about 5 days before we see those. So. The good news, too, is vaccinations right at about first dose, right at about 50,000. We're seeing those vaccinations go up a little bit. You can see over there in the red, the 2 right numbers. So we're glad to see that. We're trying to, what happens for us is if the hospital gets really full, the units, nursing units, it backs up the ED, and this is what we're seeing towards the first part of this week. So what we've done now is, and I give a lot of credit to Anna Pittman, our Chief Operating Officer, spends most of her time in the outpatient setting, Shannon Clinic. Wave your hand, Anna. She is very talented, and I'm surprised she was able to do this so quickly yesterday. So I called her yesterday afternoon and said, hey, ED's getting overwhelmed. Can you expand your urgent care hours instead of closing at 7? Stay open to 10 Monday through Friday, and within 3 hours, she was able to have that happen. So we are extending those urgent care hours to help with the ED overflow. So that's enough on COVID. Let's talk about some exciting stuff. Let's talk about some of the stuff that we have planned over the next few years. And I'm going to come down here a little bit. Really, the way we look at expansion, we look not just at the next year, but what does the next 3 years, 5 years, 7 years, 10 years look for us? So we've been very much focused on this, and so this is some of our plans. Now, I actually took this picture. I know it doesn't look very good. Obviously, it's not very professional. But I'm standing facing the hospital, and what you're seeing is two buildings. The one on the left is our retail pharmacy. The one on our right is what we call our marketing building. Also has our general counsel in there. We're going to knock those buildings down. And in that parking lot, we're going to put the Downtown Cancer Treatment Center. Now, I will have to tell you that Brian and I were thinking about this a long time ago, about 7 years ago. And so we're real excited. Our trustees are real excited about having this facility. What we're excited about is, so if you kind of go left to right, on the far left, we're going to have our medical oncologists. Now, we have two, Dr. Taraku and Dr. Cummings. We just recruited Dr. Hall. So he'll be here. He's coming from Scott and White, so he'll be here, I think, in September of 22, if I recall correctly. They'll be housed here. We'll have Dr. Stupp. We'll have radiation oncology. We'll have infusion center, pharmacy, one-stop shopping, and then on the back end, we're going to have a 5-story parking garage. And then you get over to the right, because guess what I'm knocking down is that pharmacy building and those offices. I got to build something for them to live in. So that's what you're seeing on the very right, far right. We're going to have the parking done in July of 22, and then we'll have the rest of it done by December of 22. Glad to see some of our volunteers here, ladies. This is some of the drawings of what it'll look like. Super excited about this. This is a big need here in our community, and we want to make sure that people don't have to drive for care, not only when it comes to San Angelo, but also those that live in the surrounding communities, whether it's Ballinger or El Dorado, Big Lake, and those types of areas. This is what the pharmacy is going to look like. We're going to do 3 bays. This is drawn with 2 bays, so we're going to go with a Chick-fil-A model on retail pharmacy. Don't tell Chick-fil-A I said that, because I don't want to pay the licensing fees for that. But we're excited about this. Other future projects is where the cancer services are now, or some of them are, is where this building called Magdalene that we have that's real close to the hospital. Some of y'all might have been in here. We're going to, once we move oncology from there, we're going to consolidate wound care and hyperbarics there. And then we're excited about that. So we'll start this in December of 22, basically start construction in January 23. We're also going to expand our footprint for cardiac rehab, which is a big service that we need to expand. And then women's and children's, we're going to expand that program. Y'all probably, when I'm going to have to pass the collection plate around, because I need some help on this. We're very blessed with having the Shannon Trust. Margaret Shannon left back in the 1930s. That's a trust. That's what's helping us expand here. Also, the great thing about Shannon being a not-for-profit, all the money that we stays within locally. We just announced a neonatal services agreement with Cooks, so we're super excited about this. This is going to be huge for our community. And then that's what the Women's and Children's Project is going to entail. So we'll be able to do pretty much all our women's health. Across the street is what we call the Harris Building. That's something that we started building it on Brian's watch, and I got the opportunity to finish it. But we're going to put women's imaging in that building too, so we'll move it from Bryant. This is another area, like if you ask me, like when I left the hospital today, we have 19 ICU beds. With this COVID situation, hey Doc, with this COVID situation, we're full. And we don't need to be. We need to have some beds available for emergencies that come. So we're going to look to expand our ICU footprint. Now these pictures are going to look bit. They're not as pretty as the ones you've seen, because we just early on in getting this started. But this is a picture from today. So what's my problem? Parking. Yes. Yes, it's bad. And this picture is from today. We're on the skywalk. So what we're going to do is I already mentioned that one parking garage that we're going to build 5 stories behind for the oncology patients. But what we're going to do is over to if you're facing the hospital, this would be on the west side, the left side. We're going to add another parking garage. What's that? Oh, I'm sorry. Thank you. They're rushing me now, but which I appreciate. I thought they were just saying hi. So we're going to add a parking garage, then come over the top of that with the ICU, and then add 30 more adult beds. That's what it's going to kind of look like. We're going to hopefully have this done in January 2024. I wish it was done today. And then on the other side, we're going to expand our surgical services. Again, there we're going to add parking, come over the top with that additional surgical base. That will be January 2024. Then we're going to turn our attention to the South Campus, which used to be Community Medical Center, and we need to do something with behavioral health and skilled. So we'll be looking at that process. And then I'm going to ask JT to come up and speak a little bit. JT's our Director of Pastoral Care. And got the mic? Okay. Thank you, sir.
I was entrusted with my own microphone. Everybody else is trying to give me theirs. Thanks, Shane. So yeah, I'm JT Tucker, Director of Pastoral Care, and wanted to share with you just about 2 programs that we have here in the hospital. But first, I just wanted to say I'm so very grateful to Johnson Street Church of Christ for many things. One of those is just, as Shane just acknowledged a moment ago, there's a high number of volunteers that come from here. I don't know why that is, but maybe that's just indicative of the heart of Johnson Street that is very much engaged in the community, the well-being of our city, and that's demonstrated by just amazing, truly amazing folks that don that green, is it a schmuck? Is that what they call it? Smock? Adding a C to that unnecessarily. But it's amazing just that heart behind how they serve, and I think it is probably just a true reflection of where they come from, their home. And then the other thing is, for many years, we've been blessed as a hospital to be able to utilize from time to time your mission house. I don't know if y'all knew it or not, but y'all have helped out families that have been coming here for their loved ones that have been inpatients at our hospital being treated for illnesses or injuries at times. And at times, obviously, it becomes very financially burdensome for them to come in out of town and try to take care of their meals and lodging and things of that nature. So Johnson Street has always been very gracious to share that with us. We have just a small number of guest house rooms out at the St. John's campus, and those are traditionally really hard to access. They're usually full. And so just making a call over here and speaking to Jean and telling her of the need that we've got, you guys have been just really very gracious, and we're so grateful to have that. Thank you for that. So I wanted to share with you about 2 things. One is this program that we started back in 2019, and the program is actually called No One Dies Alone. NODA is the acronym for that, No One Dies Alone. This is a program that started back in 2001 at a small hospital outside of Seattle. And the story goes, I think I just want to read this story to you to hear how it started. From a nurse that was a critical care or an ICU nurse. This little excerpt says that she was a nurse at Sacred Heart Medical Center outside of at Seattle, Washington. The nurse said, the one that started it, said, "One rainy night, I had a brief encounter with a man who was one of my 7 patients who I had just met upon coming up on shift. He asked in a very small, barely audible voice, 'Will you stay with me?' I said, 'Sure, just give me a few minutes. I need to check on my other patients.' The article says, after vital signs and passing medications out, checking on charts, assessing a few other patients, and then helping out 1 or 2 go to the restroom, I came back. It was about an hour later. She says, I returned to the room, and my patient that had asked me to stay with him had passed away. He had passed away in that 1 hour of her meeting him and then having to step away to go tend to other patients. It made such a huge, profoundly large impact upon her that she was just almost tormented with that. And so for a number of years, it just kind of just stayed with her. She couldn't shake that. And I think that as I've heard her talk about this before, she realized that just with a little bit of coordination, she probably could have found any number of volunteers within that hospital system just to go sit with this gentleman. Not necessarily skilled clinicians, but somebody from the maintenance department or the dietary or laundry, somebody else that maybe just had a few minutes to kind of share, to sit down with him as he requested to be with him prior to his dying. Obviously, she didn't know that he was actively dying, but she knew that he was very weak and very frail and wouldn't be surprised if he had passed within 24 hours. But that really just kind of shook her so deeply. And she tells a story that one of her coworkers got so tired of her talking about this over and over that she said, "Why don't you do something about it?" And so she did. She approached the administration. The administration heard her plea, and they allowed her to kind of just set up a system of training volunteers from within the hospital to be able to be trained enough to go sit with those who were dying, who were actively dying. So in 2019, we adopted that program at Shannon Medical Center. Pam Bradshaw, our CNO, was the one that had that thought about that. She had served in another hospital system, and when she came here, that was one of the things that was just really on her heart to do. So we did some training. We got some folks gathered for this, and we've done 3 training sessions now over the last couple of years. And we've got about 42 people that are trained now to sit with our folks that are at the end of their life and that don't have family available to be with them. That's the key for this, because as you know, you want to be with your loved ones when they're sick or infirmed or they just are not feeling well. And the reality is that we have kind of just a unique situation and dynamics of family situations where sometimes folks do not have family available, or they may not even have family that are still living. And so to have somebody that is comfortable enough to have been trained to go sit with that individual in their last hours or days is a powerful, powerful tool. And so I'm grateful that Shannon allowed us to do this. We've got another, we're going to postpone the next training session that we've got to prepare some volunteers for that. But I hope that after this run of the COVID variant, the Delta variant runs, that we'll be able to select this again for May of next year. So I wanted to share that with you, just knowing that we do have some volunteers from the community that have been invited in to support this No One Dies Alone program also. And so while the majority of our volunteers come from within the hospital setting, we do have some folks that are coming from other churches and even some ASU students and 1 or 2 Goodfellow folks that are training out there and have been there for a number of years. So my hope would be that we'll have the opportunity to maybe just later on, maybe I'll provide it to Phil in a way of being able to contact. If you're interested in doing that, we'll give you a website to be able to go tap into. But I offer that to you in a way of just saying there's an opportunity there within the community for folks that are interested in doing something that may be a little bit uncomfortable initially, but having a little bit of training and then being able to be directed and having some just some formal kind of education for being with those who are at the end of their life. That is such a beautiful gift to give to somebody else. So the neat thing is this program also has kind of an offshoot, and it's called No One Stays Alone, N-O-S-A, No One Stays Alone. And there again, after we get through this COVID run again, we're going to launch this program. This will be for our patients that also are in the hospital, but maybe don't have any family or aren't able to be there with them in the hospital setting. So we want to have a larger group of folks that are able to come up and just visit. And I know I get those calls from time to time, and even right now with COVID going on, it's just not feasible for them to be in the hospital unnecessarily. But we've got this opportunity for folks that truly, I think, will benefit greatly from having just a little bit more of a human touch there. There again, our volunteer program, they do a great job of going by and checking in on folks and delivering newspapers, and then just the other opportunities for them kind of being in passing with them. But having somebody that's specifically trained to go sit with somebody that's sick and in a place where they are not terribly comfortable being for very long, that's a great gift to be able to give to them. So that's all I wanted to share was just those 2 programs. No One Dies Alone, No One Stays Alone. So I don't want to open that up for question and answers just now. I think we're going to have a chance to do that here in just a minute with Holly and Anna. So I'll turn it over to them.
All All right, my name's Holly. I'm our Director of Health and Wellness at Shannon, and I'm going to talk a little bit about some of our outpatient programs, as well as some other needs and resources that we continue to see within those programs. So one of the programs that we have is called our Care Coordination Program, and what that program offers is when patients are discharged from our hospital, high-risk patients right now, a significant number of COVID patients, as well as chronically ill patients. We have a team of nurses as well as community health workers that follow up with those patients by phone. We sometimes do house visits with those patients. Ensure they have their medications. Ensure they have their follow-up appointments. Do they have any social barriers? And really just work through that continuity of care from the inpatient stay to outpatient. If they're a newly diagnosed, maybe diabetic, or other with COVID, of course, going home with COVID on quarantine, what that looks like to transition back to home and make sure we're meeting the needs that they have. Another program that we have that Anna works closely on with her team of staff is it's our care management program. And what that program does is it works with patients that are seen in our clinic, and it really helps address healthcare gaps. So patients that have appointments coming up, whether it's with their primary care doctor, maybe a specialist, we ensure that they have the information that they need going into that appointment. Do they need any screening appointments scheduled before or after that visit? Are they up to date on their immunizations? And just kind of go through that. Do they have any social barriers to make it to that appointment? And so we work with them very closely to ensure we have all of that leading up to the appointment to make sure patients have what they need. And through these two programs, as well as some other just education programs, we continue to identify a number of medical barriers, social barriers, and things that could impact seeking the health care that patients do need. And so some of those might just be transportation. So how can you get to your appointment? Do you need help getting to your appointment? And kind of working through that. Another area is medications. You leave the doctor, you have a list of medications. What does that look like to make sure you get those filled? Make sure you understand how to take them. And so we work with that as well. The last thing I would add is through, Shane talked about, early on in COVID last summer, we had a lot of state nurses coming in to help through COVID and support state staff to help make sure we had the resources we need to take care of patients. We also had a lot of local resources, so we had funding coming in, the city had funding coming in, the county had funding coming in, and so that helped put patients in hotels, ensure they had food during quarantine, and all of these things. And so we're seeing an uptick in all of that, where we've lost some of that funding that we saw early on, but ensuring we can take through that in the recent spike of the Delta variant that we are seeing. So those are things that our programs that Shannon are able to identify and that we work through and are able to support and ensure that patients do have what they need, no matter where they are financially, socially, medically, that we can work through that to make sure they're getting the health that they do need. So those are some of the programs that we have, some of the barriers and resources that we identify over time to ensure that we can work through that with the patient and meet their needs because whole person, what that looks like on a day-to-day basis. So that's what I was going to share from an outpatient side, and from there we're going to open it up for questions with the whole team.
Okay, I have a couple of questions, please. Shannon South now has 2 ambulances that serve part of that area out there. Is Shannon expecting to expand the ambulance service to not just San Angelo, but to Tom Green County and to the outlying areas? Is that something you're going to add to what you do?
You are correct. We actually have 2 ambulances, and it's similar to, that program is similar to our helicopter, where we actually staff the helicopter, but we don't own the helicopter. It's actually handled by what we call MedTrans. They're also the ones that handle those grand transports. We work with them, and they put shamrock on the sides. Of course, the helicopter has shamrock on it too. But that's actually, those are ran, and those are part of the MedTrans company. And I have to tell you right now, I don't know if we're going to maintain that service. We work closely with the EMS services with the city. And right now we're struggling with MedTrans in terms of the ground transport. They do a wonderful job with the helicopter. They are not meeting our expectations on the ground transport. So I suspect unless they change, they will be looking for another partner. But we just want that service because we feel like it's important that when we have patients show up downtown or south, that we get them to the right campus as quickly as possible. So that's why you're seeing those ambulance services at both campuses now. It might not be MedTrans, but it'll be someone in the future. But we're not going to try to go out in the county because we don't want to indirectly hurt a lot of the county EMS services by competing against them.
Second question is the third round of the COVID vaccine available at this time? I've had both my shots, but I work in the funeral business, and a lot of times we go to homes that have that, and so I'm very interested in getting the second one. And where would we go to get that shot?
It's a great question, and I noticed on the news before I came in that they're saying that booster is going to be available maybe by the end of the month, but it will be for those that are compromised. So if you fall in that category, I think they're going to say, yes, you should get the booster. But just for, like myself, I've had the Pfizer and I've had both my shots, but they might not suggest it for me because for the most part, I'm pretty healthy, at least today I am. But those that are compromised, I think they're going to suggest you get the booster, and that's something between you and your doctor, or if you feel like you're compromised, you need that booster. But I think we'll see that in another month. That was just based on what I saw in the news just before I walked in. If y'all, the COVID news and environment, it changes so much. It's so fluid. So it seems like even I had to be careful what I say, because it seems like whatever I say, it changes the next day. It changes on us the next day. But I do think that's going to be available in the next 30 days for those that are compromised.
Shannon also planning on using the bells for all for COVID.
We're out of the Bells location today. We're actually doing our vaccination clinic on our south campus. If you're facing that campus, it's on the far left. We're using the conference rooms for our vaccination clinic, and we're running it 7 to 4 Monday through Friday, but on Tuesdays we run it from 7 to 7, so we have extended hours. But what we'll do is if we see that we need to expand it, that's too small, we'll look for a bigger area, like the Bells location. We'll look for a large location. That way we can vaccinate more people. So we'll shift depending on the need.
Yes, my question is, what is the turnaround time for a PCR test?
24 hours. Great question.
Is there any way to get it where it doesn't take that long for employers in town that have employees going at every exposure to go get tested? It's very frustrating that they're told it'll be 24 to 48 hours, and then they're 2 days out of work for a negative test when they could go somewhere else in town and it takes 20 minutes to get the results. It's very frustrating as an employee.
Are you referring specifically to the PCR testing, or would an antigen work?
What are they doing at Shannon, by Target?
We offer both. So if you do the antigen, which is point of care testing, we can result there at the location within 15 minutes.
Are they giving them a choice?
They should be, yes.
So we need to
If that's an
educate our
opportunity.
employees then.
Yes.
Okay.
So I think
Good
it's
to
a
know.
difference between if you want the PCR, which A lot of airlines are requiring that. Some employers are requiring PCRs, or if you're okay with the antigen, we can actually
Okay.
do that within 15 minutes.
Okay, good to know, thank you.
We'll go back and make sure that we're offering the choice, so we need to double check that we're doing that. So we'll go back and double check.
Okay.
It's been tested and told it'll be 24 to 48 hours.
I'll definitely go back to the teams and make sure that they are communicating that.
Other questions? Oh, right here. I got you.
Okay. Recently, I had a student who became ill with COVID. Her husband works oil field. She had 5 little children at home, from 14 down to 2-year-old twins. Everybody got COVID. And I think someone from the hospital was checking on her. But I wondered what supports are in place for someone like that. I went shopping and took her some stuff, but I was just really worried about her.
Yes, so we do have a team that does phone calls, but right now that team is specific to calling patients that leave our ED, as well as patients that are discharged from our hospital. So those are the patients that are followed by phone for 7 to 14 days based on their severity of illness. So checking on them, asking them for their O2, so kind of where are their oxygen levels, and making sure they have what they need while they're in quarantine, and advising them if and when they would need to come back in to see a provider.
I'm not, on the booster you mentioned for the vaccine, is that booster just for the Pfizer, or both Pfizer and Moderna?
What's that? It's Pfizer. The news story I saw before I came in was Pfizer specific.
So like Beth and I had the Moderna, so we currently, Moderna's not offering.
I haven't heard anything on Moderna either.
Even if I had the Moderna, you believe so? So I can trust you.
We'll find out for sure, Brian, and get back with you. He did ask a tough question, didn't he?
Yeah, not for you. Okay. I wanted to continue with her question about the family. Is there some place like she may not have contacted anyone. She may not have had contact with the hospital or a clinic or whatever, and she's there at home with all those kids. Is there a place or a number to call and say, look, here's this woman, can we do something? Would it be, I mean, if you were to call that, could you follow up on that?
We do have a COVID hotline. It's 866. I'll look it up on the website before we leave. It's on our, if you go to our Shannon Health on our COVID information site, there's a Shannon hotline, our Shannon COVID hotline, and you can call that number and they can direct to our team where we could work through addressing any social needs or family needs that are identified.
Beth, this was really cool. The first go around of COVID, we found that there were a lot of things that we were kind of figuring out as we went. And one of those was not too dissimilar to what she just described a moment ago. And I want to say that there was a little family down in Richland Springs, Texas, that had something not real different from what she was describing. And so they were needing somebody to take over some groceries to this little family. And so I don't know how exactly we got looped into the pastoral care department, got tapped for it. So we called and reached out to a church down there. I think it was a Baptist church. And that really kind of set the tone. We started utilizing local churches throughout that whole span. And every single time something came across my desk that asked for something that was just a little bit unique that there wasn't a structure for, the churches of this town in this region were amazing to respond. I looked like a real sharp guy because everything that got asked of me, I didn't do it. I didn't do squat other than pick up the phone and ask. And everybody just rallied. I'm so grateful for that.
I'm going to attempt to redeem myself on I believe so. So, going back to your question, Brian, back when we started administering the COVID vaccines and we received our first shipment of Moderna, we never received the second shipment. Well, we did, but not everybody that got the first Moderna vaccine received the second dose of Moderna. And I do remember that we approved, as Shannon, our protocol was that those people did get offered the Pfizer, and there were a bunch of people that got the first dose Moderna, second dose Pfizer. So I'm confident we can do that.
All right. Y'all stay right there. Stay right there for a second. That number is 8446 Shannon. So there you go. If you need that, you can look that up.
How do we forget the Shannon?
So, but thank you guys so much for being here. Let's show them our appreciation if we could.
Thank you.